Hey y'all, and welcome back. Welcome back to my channel about disasters. Today, we'll briefly touch on potential life disasters. Now, I'm sure most of you have heard the saying, health is wealth. Well, that goes for sexual health as well. Now, this may be a little difficult or uncomfortable for some people to hear this type of information that I'll be sharing. So, if the topic about sexual health makes you uncomfortable, please don't watch this video. You can turn it off. It's okay. STI and STD refer to the same group of infections that are spread through sexual contact. STI is sexually transmitted infection and is now the preferred term, as it emphasizes that infections can be present without causing any noticeable symptoms of disease. Now, STD is an older term that implies a more severe or obvious disease process. Today, I'll be using the two interchangeably. Before working in my current field of natural disasters, I worked in the field of prevention of STDs and HIV and substance abuse. I started off conducting street outreach in very high-risk communities in and around the greater New Orleans area. I worked for many years in prevention, and when Hurricane Katrina devastated our city, I was working as an HIV prevention program coordinator and early intervention services case finding supervisor. So I was overseeing two different programs. This field has always been my passion because of the relationship building with the most vulnerable communities. And in a way, it's similar to what I'm doing now, relationship building in the communities. Are you aware that there are 6 common STDs that often get misdiagnosed? They can mimic other infections or show no symptoms at all. You have chlamydia, gonorrhea, syphilis, herpes, HPV. Those are the usual suspects, but their signs can be pretty sneaky. Herpes. Genital herpes are characterized by a cluster of itchy, small red bumps or tiny white blisters, which they usually appear a few weeks after the infection. So as the outbreak comes to an end, then the skin will begin to form scabs as the ulcers heal. These uncomfortable bumps associated with herpes can sometimes be mistaken for other non-sexually transmitted infections, such as ingrown hair, shaving or razor bumps, jock itch, or genitalia eczema. Next, we have gonorrhea, which is an STI or STD, which can take 2 to 10 days to fully develop. The symptoms can be a copycat of the symptoms usually attributed to a UTI or a urinary tract infection. Next, we have chlamydia. It's a common infection which is transmitted sexually. And if it's untreated, it can lead to infertility. It's often underdiagnosed because the symptoms can be very nonspecific or non-existent. Next, we have pelvic inflammatory disease, or PID, which is not a sexually transmitted infection or disease. It's a complication which can develop following multiple sexually transmitted infections, specifically gonorrhea and chlamydia. When you have PID, the bacteria spreads to the uterus and the female reproductive tract. This can result in infertility. Now let's go to trichomoniasis. Trich is a common but curable sexually transmitted infection, and it's caused by parasitic protozoa. Now, there are 1 million new cases of trich that occur in this country every single year. This infection is one of the causes of something to be cautious of, because women may have symptoms, but men do not. This can leave you more accessible to contracting HIV if you are exposed. Now, only 30% of people develop symptoms, which can range from, say, a mild irritation to severe inflammation. Yeast infections. Yeast infections technically aren't STDs. They mimic them and often are mistaken for an STD or STI. Yeast infections are quite common, with 3 out of 4 women experiencing them at some point in their lifetime. And guess what, men? Men can experience them too. For women, a yeast infection is a common fungal infection that develops when there's too much yeast in a lower private area. I'm trying to be respectful. Every woman has yeast in that area. However, there's a certain amount that's healthy and normal. But when the bacteria becomes unbalanced, it can lead to an overgrowth of a specific type of yeast called Candida, resulting in an uncomfortable infection. Most yeast infections are mild, and they can clear up within a few days with over-the-counter treatment or prescribed medications. Others can be more severe and take up to 2 weeks to clear. Some mild yeast infections can occasionally go away without any treatment at all, and the help, or maybe with just the help of home remedies. But more often than not, you'll need over-the-counter prescription medications to treat the yeast infection completely. Now, the first line of defense against the damage caused by sexually transmitted infections or diseases is to avoid it altogether. This is usually the part that some folks don't like to hear. Reducing the number of sexual partners can limit the risk of infection, and the use of protection often prevents transmission of sexually transmitted diseases between sexual partners. And even with these measures, it's important to get treated frequently, tested frequently, particularly with new or multiple partners. You've got to get tested. Consistent testing is the best way to detect a sexually transmitted disease that don't exhibit any symptoms, particularly chlamydia, gonorrhea, and HSV. Testing is often available at your doctor's office or health clinic. And given the stigma that surrounds, still today, stigma that surrounds sexually transmitted diseases, at-home testing is increasingly becoming a viable option to expand the number of people who get tested on a regular basis. Vaccination is also key to preventing infections by several viral pathogens, including HBV and HPV, as well as STIs and STDs, associated cancers. Together, testing and vaccination can reduce the spread of sexually transmitted infections, and doing so protects against the hidden damage that they cause. Getting tested regularly and knowing the right questions to ask your doctor is crucial. Write your questions down before you get there. Don't ignore any unusual symptoms or discomfort. Talk about it. Talk with your doctor about it. Yo, stay informed. Stay safe. And do me a favor, share this information